Hi, I'm Kim, a registered dietitian and certified specialist in oncology nutrition at Smilow Cancer Hospital. Good nutrition is important to help keep you feeling your best during and after cancer treatment. Protein is one dietary component that you cannot miss. The purpose of this short video is to discuss all things protein, including why it's important and how to make sure you're getting enough at any point in your journey.
So what is protein and why is it important? Protein is a molecule found throughout your body that's made up of amino acids, some of which your body is able to produce and others that you have to get from food. Protein provides energy for your body in addition to many other functions. It supports maintenance and growth of muscle and other tissues, forms antibodies, hormones, and enzymes that drive many bodily functions, such as immunity, digestion, and blood clotting, to name a few. It also helps transport and store nutrients and maintain fluid and pH balance. When your body doesn't get enough protein or energy, it might break down muscle for the fuel that it needs. This can lead to weight loss, weakness, and lowered resistance to infection. For these reasons, adequate nutrition, including protein, and avoiding unintended weight loss during cancer treatment promotes overall better outcomes and helps with recovery from treatment. So how much protein do you need? Protein needs vary, but are generally higher with a cancer diagnosis or during treatment than without, and can be higher due to your cancer type, treatment, and any other medical conditions you may have. On average, a person with a cancer diagnosis may need 1 to 1.5 grams per kilogram of body weight per day. To put this into perspective, a 150-pound person may need about 70 to 100 grams of protein per day while undergoing cancer treatment. So we know protein is important and how much we need, but where do we find it? There are both animal and plant sources of protein. Fish, chicken, turkey, eggs, dairy, and meat are all animal sources, while plant sources include beans, nuts, seeds, lentils, and tofu or soy. Other foods such as whole grains and some vegetables offer smaller amounts of protein, but they are not considered high sources. You ideally want to try to eat a variety of protein-rich foods to not only ensure you're meeting your protein needs, but to also get a variety of vitamins, minerals, fiber, and other nutrients needed for optimal health. So how much protein is in different foods? This chart shows protein sources, typical serving sizes, and how much protein is in that serving. As you can see, foods contain varying amounts of protein. Animal sources such as chicken or fish contain the most protein per serving, while options like nuts provide less, but are still valuable to include. So let's think back to our example of 70 to 100 grams of protein per day. How do we reach this amount? Having 2 eggs in the morning, salmon on a salad with a side of Greek yogurt in the afternoon, and chicken at dinner would equal about 70 grams. You can reach higher into this range by snacking on a handful of mixed nuts and having an apple with sliced cheese for a snack. So what about protein supplements? A protein supplement is likely not needed if you're able to eat well, including a variety of protein foods, but may be beneficial if for any reason you are unable to eat enough or are losing weight without trying. There are many protein supplement options available, from bars to powders and prepared shakes. Some may contain ingredients that are not recommended during cancer treatment, so it is important to notify your care team of any supplements you are taking. If you'd like guidance, you may also ask to speak with a dietitian to help choose the right option for you. If you would like additional assistance on this or any other nutrition topic and are receiving care at any Smilow Cancer Hospital location, you may ask your care team for a nutrition referral or contact our dietitian team at the email or phone number listed here.